So as Anna said, we did notice that there was an increase in individuals sort of reaching out to us, referring to us who were struggling with trading products like crypto. So on the screen there you'll see that currently we're seeing about 12% of those that are contacting us there reporting crypto or financial trading products as their primary concern. So on the left-hand side there you'll see some financial products. So these are the types of products that we're seeing. So some might be familiar to you, so crypto I know is a big one. CFDs as well, we're also seeing a lot more of. So just for context, thinking about cryptocurrency more kind of globally. So it is huge and it's only increasing. So I think the value of cryptocurrency is nearly surpassing the UK's GDP. So for context, we have the 6th largest economy in the world. So the fact that crypto's nearly surpassing that just shows how huge it is. One thing to note as well, these products are not regulated at all. So there's no regulations and the risk we're seeing is a lot higher. So for something like CFDs, due to the leverage and the risks, you can lose more money than you put on, basically. So it puts people in a very vulnerable situation. So as I mentioned, the products, the financial products are very different to gambling products. So although sort of gambling and trading are fundamentally similar in their process, the products are very different. And Anna's going to just talk you through how they're kind of portrayed in the media, through adverts.
So you'll see on sort of the left-hand side, we've got like a traditional sort of gambling advert for high power. So usually what we're finding is that a lot of the sort of like traditional gambling adverts are regulated, as Jess said. So at the bottom of a lot of these adverts, it's for gamble aware. It's very obvious that like there is sort of like regulation, it's kind of warning people of the harm. However, you'll see in a minute when Jess explains that that is not the same case when we're looking sort of at trading sort of advertisement. These are not regulated. But the way that it's sort of portrayed for gambling is it's something that is for more entertainment purposes. It's a bit more like fun or sort of portrayed in that way. It's a bit more playful. And we have found as well that there's a lot of sort of like celebrity endorsements. And we'll touch upon this in the next sort of couple of slides. But that's obviously something to be aware of as well. But Jess is going to talk through a little bit more about what the difference is, as you can see.
Yes. So for the trading. So for the trading advert, as you can see, there's no kind of slogan saying about awareness, there's no gamble aware. It's also a very different style, so there's men in suits, it feels more kind of corporate, more business-like. The word investor on there as well, so it's really this idea that, or portraying this idea that you can become an expert, you can become an investor yourself. It's depicted as a way of a legitimate way of making money, something that the gambling adverts can't do due to the regulations, but the trading advert really does suggest that this is a legitimate way of making money. And yeah, you can just see sort of how different those are.
So we're just going to show a couple more sort of like advertisements for trading. So as I said, you'll see there's quite big celebrities even on the board there. We've got like Matt Damon, we've got Reese Witherspoon. So there is a bit more of a target for, we have found a lot of men majority with the clinic, however there is some women, but we would say it's a bit more male dominated. But however it is kind of like more talking, or the function of the trading is quite different. So it is more looking at sort of like the value of money, as kind of Jess said, about being kind of like successful, and also more about legitimately making money. Like it's not just for entertainment. But even the way that it's advertised, as we know, a lot of gambling adverts are on like the tube. We've also noticed that there's a lot of like Bitcoin adverts which are targeted, as we've seen, kind of like for men and women, and even like targeting women of all ages and men of all ages as well. So even trying to maybe even look at how it's like targeting people who are working people. Are they going to quit their 9-to-5 jobs to make legitimate money? That is something that a lot of us maybe would see on an advert, and that could intrigue you. So I guess that's something to just note with like how it's advertised as well, that it's quite different. So Jessica's going to talk a little bit more about sort of like the jargon of trading as well, because it is very confusing, we would know as well. it's been quite like difficult to understand. So just
yeah, so Emma and I we just did a simple Google search and we ended up on Reddit. And there's lots of forums about trading, investing. And we noticed that a lot of people kind of end up glamorizing their losses. So there's a real competitive nature on these forums about how much you could lose, and almost sort of that's almost seen as a good thing that you're able to lose that much money and it will be okay. The language that is used to describe investing and trading, it's a lot of jargon. So if you look on the screen now, it doesn't really make sense to me. But it kind of creates this exclusive group, kind of us and them almost, and it's very confusing. So yeah, this is the kind of the nature of it that we're seeing online as well.
So we're going to discuss a little bit more about sort of like what we offer here at the clinic, and kind of a little bit more about like, you know, we did basically try to sort of like offer group interventions for traders. However, we did find that a lot of the feedback that we got was that people, you know, maybe didn't feel that they related to the material that we were doing in group settings for, you know, gambling treatment. A lot of people as well don't even like to even be referred to as a gambler. A lot of like traders will be like, I'm a trader, as a professional, you know, they do not see it as kind of like the same way as well. So we had a bit more of an idea that we thought that, you know, the traditional way that we offer treatment is like, you know, one-to-one therapy for cognitive behavioural therapy or group settings. But also, as Jess we saw in the last sort of slide with the Reddit forums, with the way that people are in the community sort of expressing, you know, losses, you know, it was maybe a little bit of, interpersonally, a bit of a difficult group to sort of like manage, as well as people didn't really get the most out of treatment. So Jessi's going to talk through a little bit more about how we've sort of like adapted the material for trading related harms for our clients in the CBT protocol.
Yes, so the main change is everything we deliver to those experiencing trading-related harms is one-to-one. So it will follow a similar cognitive behavioural therapy model, but it's important to note here that the function is usually different for gambling and gaming, although very similar in their process. So treatment will focus on the different functions. So with gambling, I appreciate it might be generalising, but we might see more recreational use, entertainment, whereas with the trading kind of honing in on that financial element, the value of money, and that may be perpetuating the difficulties. Another thing I would mention, and I know this was mentioned earlier, so for anyone experiencing trading or gambling, we'd encourage people to try and self-exclude initially, so blocking off access to money and also gambling facilities like the software. But with trading, this is a lot harder because it is so unregulated. We've also had clients sort of tell us that people from these websites will call them up. They almost become a bit of a friend to them. It becomes very personal. I think someone said they've been invited out to kind of these lavish parties and events. So, you know, it really is, it's tricky to block off these access to these things. And sort of just adapting our language as well. Obviously, as clinicians, as services, we need to make sure that we're using relatable language and not ostracising people. So yeah, it's tailored slightly differently there. I think anything else on the treatment pathways? No? Okay, so now we're going to just share what we've kind of learned from this pilot. So obviously it's still ongoing. We don't have all the answers, but we've there's a few things we've learned and a few reflections that we have. So I'll start with that.
Yeah, so as Jess said, it is sort of like ongoing, but there is a few sort of reflections. So we have found that it is also, as I said previously before, with the advertisement, it is men and women. However, we do see a lot of like men that have come to the service. A lot of the sort of like themes that are coming up as well is a lot of people struggling with like masculinity. You know, as we said previously, there is a real sort of like emphasis on being successful, the value of money. And a lot of people, we would say as well, are maybe like working in sort of like finance or investment banking, and then there is a bit of a blurred line between sort of like their trading and their work, which is then becoming a bit harder when you're doing treatment with these clients, because maybe they don't really see it as sort of a harm, or maybe, you know, they're seeing it as like a job or a profession. Another part of this as well is kind of like what Jess was saying. that, you know, sort of like the function is different ultimately, but we're sort of trying to kind of like, you know, evolve as a service and think a lot more about how we sort of can sort of like adapt material, but Jessica can talk a little bit more about this.
Yeah, so it is forever evolving, and I'm sure we can all agree we will see new platforms, new things every time we meet someone who is trading. So as a service, it can be sometimes hard to keep up with these things, these platforms. There's also kind of merging between gambling and trading as well. So a lot of gambling platforms are now using, like the more traditional sites like casino are using cryptocurrency as their kind of currency, and that helps people kind of bypass the blocks they have in place, so it can become very complex. So yeah, it's forever emerging, and I think we're kind of learning new things every day with this, really. Yeah, anything else? No? Yeah, any questions?
Do people self-refer?
Yeah, so people can do sort of like online self-referral, or we do take sort of like GPs as well that can refer to the service. But yeah, we do also work, so this is for trading, but also like we do have as well a lot of people obviously gambling would then reach out or by self-referral or by a GP as well.
Or any mental health team?
Yeah.
Pretty much any, yeah. Anyway.
And what tools do you use to assess the severity of someone ordering you?
So at the moment, we did use the PGSI just generally. We have changed to the, is it the GSAS now.
Yeah.
Obviously, there isn't yet a specific measure for trading specifically. It's kind of that umbrella, but yeah, that's what we generally use.
Because they come through our service and have their regular gambling assessment, and that's when we'd identify them. So what's really interesting is that 12% number is of everybody who's seeking gambling treatment, and then we identify them there, so that we're not even advertising it.
So you definitely separate, but the treatment tends to be the same for each area of gambling that you tackle within the clinics. So CBT based.
Yeah, so I mean, yeah, there's nuances. We're generally CBT based. We tend to use more of an ACT approach with our 13 to 18 year olds. And we've got systemic therapy and psychodynamic therapy and peer support, but CBT is kind of our main arm, I'd say.
And are you seeing the risks of these patients, these clients much higher than normally for gambling, just slots, etc.? Are the stakes higher in terms of, because we know in terms of suicidality, the higher the debt you're in, the higher that is?
Yeah, I would say that there is a real sort of severity maybe in terms of like losses as well. So we have known that a lot of people, it might maybe even 100, 150k in terms of like losses. The amount people are losing in a very short amount of time is a lot more money as well. So I think, especially when maybe someone's got like a mortgage, very young children, yeah, I would definitely say that maybe there's also a lot of like high sort of like suicidality, even maybe as we would have kind of mentioned before, like people maybe struggling with like adverse child experiences, trauma or something's happened as well. But I feel like, does that answer your question a bit more? Yeah.
It was really interesting because we do have people come through to us, and we are developing that body of knowledge, so that was really helpful. Thank you very much.
Yeah, no worries.
Can I just
Thank
ask
you.
something? Sorry. How long is your treatment? So how many sessions would you offer somebody?
Well, in terms of like CBT at the moment, so we have sort of like developed a new protocol at the moment in terms of like our group interventions and one-to-one, and that usually is around 10 sessions. However, correct me if I'm wrong, Andy, I feel like we do sort of like kind of do it based on the individual sometimes, that sometimes depending on where they're at in terms of treatment, but I would say it's more or less like 10 sessions.
Yeah, our group program's 10 sessions, but individually, for CBT, we can be quite flexible.
Yeah.
We obviously want to keep it time limited, as that's the nature of CBT for it to work, but we wouldn't have a really hard cut-off for individual work.
And if somebody presents as really high risk, what do you do with those clients?
So we do have quite a lot of clients that do present with like very high risk. So we've not really sort of mentioned it, but a lot of clients maybe have maybe like psychosis, sort of like severe sort of like mental health issues, and we do treat them as well. So a lot of like complexities might come from like a mental health team. We do a lot of liaison work. Our colleague Phil isn't here with us right now, but a bit of a shout out. He does a lot of work with sort of like liaising with mental health teams, especially we have seen sort of like the rise of like aripiprazole, being a lot of issues with like linked to gambling or dopamine agonists. So I would say that like also we're kind of like always duty workers, me and Jess. So we do get a lot of like high risk clients that come in. We are sort of like developing a new sort of process at the moment where people will sort of fill in the referral form and then we'll sort of like manage the risk when we get it. But yeah, we will see a lot of risk, but we sort of like manage it like immediately. Yeah.
Thank you. Hiya.
Hey.
That was really interesting, thank you. I was just thinking about group work. So the people that come to our service are almost, it's very difficult because they're so broken to say you've now got to go straight into a group. Do you prepare people for groups, and once in groups, what's the dropout? How do you keep them in the group?
Yeah, so we
It's
do.
quite challenging.
Yeah, no, you're right. So we have a phase 1 of treatment which happens before the group, and that is one-to-one sessions, which is getting people on their feet basically, like kind of stabilisation. If someone can't attend the group, we kind of always offer, maybe try and offer an alternative if we can, but we do the phase 1 work to get people in a position where they feel okay, okay in a group. So we do that kind of work beforehand too.
And so phase 1, would you get a number of sessions, or that could be as much as you?
Yeah, that's quite flexible. So we have like rolling groups. So if someone is then ready for the group, they can kind of attend. If not, we would just keep kind of offering them one-to-one until they, the next treatment was offered, whether it's one-to-one or CB group.
Yeah, and it's more like phase 1 because we start it immediately after assessment. It's really about helping them prepare and get ready for CBT because it is quite full on once it starts. So they get experiences with the workshop to feel what the group feels like, and it's more of a bit of a discussion between the phase 1 worker and the client when they're ready to start CBT, whether it's in a group or individual.
One more question from Harge.
Yeah, so on the presentation you said that typically the men that come to you are male. So do you have an understanding of what that ethnicity looks like? Are they primarily white? And also, what sort of, are you focusing on the London area or is it national?
What would you say in terms of ethnicity?
I would say that we're sort of still in like, in terms of like a rough estimate, I would say like we have a lot of different diverse groups that come to the service. I wouldn't say it's predominantly white. We do at the moment also, it's not just sort of like the London area, so we have taken people elsewhere because it is a pilot as well. We're still sort of like figuring things out, but we have offered sort of people a little bit further out of London as well, so it's not just solely people who are within the London catchment area. But yeah, I would say like we're still sort of like in the early stages of the work, so I'd want to like give more of a sort of like concrete answer with that once we've sort of got the data from it. But yeah, thank you for the question.
Thanks, girls. Before we get the next person, I want to add something to that. I'm probably one of the few people in the room that understood all that jargon. I probably prefer myself to the original voice of lived experience in this field, and my gambling was born out of being a city trader. So bull markets, bear markets, Wales, that's second language to me. One of the things that I think you really need to be aware of, everyone needs to be aware of, it's exactly the same. It's great we're doing this pilot, but I remember spending the first 5-10 years of my life when I got into treatment saying, I'm not a gambler, I'm a speculator. So everybody works in the city that trades, we're all speculators. That's a lovely way of saying a compulsive gambler, and a different way of saying it. And we've worked with many people in the city over the years, and literally it all boils down to, once they start realising it's a gambling problem, it's a lot easier to treat, and not giving too much credence to what form of gambling it is. But I just wanted to add that, and now we will welcome to the stage a presentation on cryptocurrency.